Colin, are you ready?
Yes, sorry.
Yep. Order! I call the Secretary of State for Health, Secretary of State Matt Hancock.
Thank you very much, Mr. Speaker. And Mr. Speaker, with permission, I'd like to make a statement on coronavirus. The virus remains a powerful adversary, but we're marshalling the forces of science and human ingenuity, and these forces are growing stronger, and I have no doubt in time that we will prevail. The latest figures show that the number of cases continues to rise, so we must all play our part to get it under control. As I've said from many times at this dispatch box, Mr. Speaker, our strategy is to suppress the virus, supporting education, the economy, and the NHS until a vaccine can be deployed. Mr. Speaker, that is our plan, and with the resolve that we must all show, we can see that that plan is working. Before turning to progress on testing and on vaccines, I first want to update the House on our response to the new variant strain of coronavirus that has been identified in Denmark. This shows how vigilant we must be. We've been monitoring the spread of coronavirus in European mink farms for some time, especially the major countries for mink farming like Denmark, Spain, Poland, and the Netherlands. Spain has already announced the destruction of its farmed mink population in April. On Thursday evening last, I was alerted to a significant development in Denmark of a new evidence that the virus had spread back from mink to humans in a variant form that did not fully respond to COVID-19 antibodies. Although the chance of this variant becoming widespread is low, the consequences, should that happen, would be grave. So working with my right honourable friends, the Home Secretary and the Transport Secretary, and all the devolved administrations, we removed the travel corridor for travel from Denmark in the early hours of Friday morning. On Saturday and over the weekend, following further clinical analysis, we introduced a full ban on all international travel from Denmark. British nationals or residents who are returning from Denmark, whether directly or indirectly, can still travel here, but must fully self-isolate, along with all other members of their household, until 2 weeks since they were in Denmark. I know these are serious steps, Mr. Speaker, and I understand the consequences for people, but I think the whole House will understand why we had to act so quickly and decisively. Be in no doubt, Mr. Speaker, we will do what needs to be done to protect this country. Now, Mr. Speaker, we do not resile from our duty to protect, and to suppress the virus, we must harness new technology to keep people safe and in time to liberate. Our ability to suppress the virus begins with testing for it. And the House will know that we've been driving forward testing capacity based on new technologies and old. Yesterday, our PCR testing capacity stood at 517,957, the largest testing capacity in Europe. Over 10 million people in the UK have now been tested at least once through NHS Test and Trace. And our NHS COVID-19 contact tracing app is now approaching 20 million downloads. And yet, this historic expansion is just one part of our critical national infrastructure for testing. Just as we drive testing capacity on the existing technology, so too we've invested in the development of the new. Now, I've been criticised with this obsession for new testing capacity, but we have not wavered from the task, and now we're seeing the fruits of this effort. Last week, we expanded the pilot in Stoke-on-Trent to Liverpool, where we've deployed enough of the cutting-edge lateral flow tests to offer tests to the whole city. These tests can deliver a result on your infectiousness in under 15 minutes, so people can get an almost immediate reassurance about their condition, so we can find and isolate the positives and reassure the negatives. To make this happen, NHS Test and Trace has been working side by side with the logistical heft of our armed services and Liverpool City Council. And I want to thank Mayor Joe Anderson and his whole team for their work. Next, these tests allow us, from today, to begin rolling out twice-weekly testing for all NHS staff, which will help keep people safe when they go into hospital and help keep my wonderful colleagues in the NHS safe too. Now, the next step is to roll out this mass testing capability more widely. So I can tell the House that last night I wrote to 67 directors of public health who've expressed an interest in making 10,000 tests available immediately and making available lateral flow tests for use by local officials according to local needs at a rate of 10% of their population per week. That same capacity, 10% of the population per week, will be made available to the devolved administrations too. And by combining the local knowledge of public health leaders with our extensive national infrastructure, we can tackle this virus in our communities and help our efforts to bring the R down. Testing provides confidence, and it's this confidence that will help get Britain back on her feet once more. Finally, Mr. Speaker, while we expand testing to find the virus, the best way to liberate and to get life closer to normal is a vaccine. And I can report to the House the news of the first phase 3 trial results of any vaccine anywhere in the world. After tests on 43,000 volunteers, of whom half got the vaccine and half got a placebo, interim results suggest it's proving 90% effective at protecting people against the virus. This is promising news. We in the UK are among the first to identify the promise shown by the vaccine, and we secured an order of 40 million doses. This puts us towards the front of the international pack. And we've placed orders for 300 million further doses from 5 other vaccine candidates which are yet to report their phase 3 results, including, of course, the Oxford AstraZeneca vaccine. I just want to be clear to the House. We do not have a vaccine yet, but we are one step closer. There are many steps still to take. The full safety data is not yet available, and our strong and independent regulator, the MHRA, will not approve a vaccine until it is clinically safe. And until it's rolled out, we won't know how long the effect lasts for, or its impact not just on keeping people safe, but also on reducing transmission. As Deputy Chief Medical Officer Jonathan Van Tam said yesterday, it's like the first goal scored in a penalty shootout. You haven't won the cup yet, but it tells you that the goalkeeper can be beaten. And beat this virus we must, we can, and we will. Yesterday's announcement marks an important step in the battle against Covid-19. But as the Prime Minister said, we must not slacken our resolve, and there are no guarantees. And so it's critical that people continue to abide by the rules and that we all work together to get the R number below 1. Mr. Speaker, if this or any other vaccine is approved, we will be ready to begin a large-scale vaccination programme. First, to priority groups, as recommended by the Independent Joint Committee on Vaccination and Immunisation, before rolling it out more widely. Our plans for deployment of a COVID vaccine are built on tried and tested plans for a flu vaccine, which we of course deploy every autumn. We do not yet know whether or when a vaccine is approved, but I have tasked the NHS with being ready from any date from the 1st of December. The logistics are complex, the uncertainties are real, and the scale of the job is vast. But I know that the NHS, brilliantly assisted by the armed services, will be up to the task. I can tell the House that last night we wrote to GPs setting out £150 million of immediate support and setting out what we need of them, working alongside hospitals and pharmacies in preparing for deployment. The deployment of the vaccine will involve working long days and weekends, and it comes on top of all the NHS has already done for us this year. And I want to thank in advance my NHS colleagues for the work that this will entail. I know that they will rise to this challenge of being ready, when the science comes good, to inject hope into millions of arms this winter. Mr. Speaker, the course of human history is marked by advances where our collective ingenuity helps us vanquish the most deadly threats. Coronavirus is a disease that strikes at what it is to be human, at the social bonds that unite us. So we must come together as one to defeat this latest threat to humanity. There are many hard days ahead, many hurdles to overcome, but our plan is working, and I'm more sure than ever that we will prevail together.
Shadow Secretary of State Jonathan Ashworth.
Well, Mr. Speaker, and as always, I thank the Secretary of State for advanced sight of his statement. And may I just take this opportunity to congratulate President-elect Biden and Vice President-elect Harris. I'm sure the whole House looks forward to close international cooperation to defeat this virus. Can I welcome the announcement in the last 24 hours of routine testing for frontline NHS staff? He will know that this is something that I, and indeed the chair of the Select Committee, have been pushing for some months now, and it's welcome that we're now in a position to extend that testing. It is important not just to protect our NHS staff, and I join with him in thanking them, but it's also important for infection control in healthcare settings as well. On the rollout of the lateral flow test that he has announced today, I understand that he's giving discretion to directors of public health, but does he agree that relatives of care home residents should be given priority access to these tests so they can go into the care home, see their loved ones, and even maybe hold their hand or hug them? Now, testing is only one part of the jigsaw, of course. So to avoid this lockdown becoming a letdown, we need to put contact tracing in the hands of public health teams from day one. So can he update the House on how he is fixing contact tracing? And Dido Harding, he may have seen at this relevant Select Committee just now, has confirmed that when it comes to isolation, that people find it very difficult. The need to keep earning and feed your family is fundamental. So will he now accept that a better package of financial support is needed to ensure that isolation is adhered to? Now, on the vaccine, Mr. Speaker, this is indeed a moment of great hope in a bleak, dismal year that has shattered so many families. We are optimistic, though cautious, quite rightly. We need to see the full results, the demographic details of the trials, and understand the implications for severe cases. There will be clinical judgments by the relevant committee around the priority lists, which we all understand. But could he outline the latest clinical thinking around vaccination of children? And will the disproportionate impact of the virus on minority ethnic communities be taken into account by the relevant clinicians when drawing up the final priority list? What is the government's current working assumption of the proportion of the population that needs to be vaccinated to establish herd immunity and bring R below 1? And over what time frame does he envisage that happening? And how many doses does he think we will need? Now, as we vaccinate the most vulnerable, there will be less people at risks, and deaths and infections will come down. But the virus is now endemic. So is it the government's current working assumption that social distancing and mask wearing will need to continue until that herd immunity is reached? Now, fundamentally, for this to work, we need a plan for the manufacture and distribution of that vaccine. And can I gently suggest to the Secretary of State that the rollout of test and trace and the early procurement of PPE wasn't as smooth as it might otherwise have been? Now, none of us as constituency MPs want to see booking systems overloaded and our constituents told to travel hundreds of miles for a jab like we saw earlier this year with testing. So what is the plan? Will he publish a strategy, and can he tell us how much will be invested in the COVID vaccination programme? We need secure supply chains. So is the government working internationally to ensure there is enough raw materials, enzymes, bioreactors to guarantee the mass manufacturing that is needed? On distribution, the Pfizer vaccine needs to be kept at minus 70 degrees centigrade. Cold chain transport and storage is needed. Now, a year ago, he used to boast that he was the country's biggest purchaser of fridges. So is he procuring the appropriate storage equipment now? Would liquid nitrogen and freezers be provided to health centres, to doctors' practices and care homes? And will cold chain distribution be in place in all parts of the country? Mr. Speaker, last year, the World Health Organization described vaccine hesitancy as one of the top 10 threats to global health. So can I again reiterate my offer to work with him on a cross-party basis to build public confidence in the vaccine, promote take-up and dispel anti-vax myths? And indeed, I rather suspect if all members working across the House to promote take-up would probably prove more cost-effective than paying £670,000 of taxpayers' money to fancy PR consultants. Mr. Speaker, this is indeed an important moment. We see a glimmer of light in the distance at the end of this long, dark tunnel. Our constituents are hopeful, so we look forward to rapid progress in the distribution of this vaccine so we can all get back to normal.
Thank you very much, Mr. Speaker, and I'm very grateful to the honourable member for his questions and the approach that he is rightly taking. Like him, I'm delighted that we're able to roll out routine testing to NHS staff, and that starts today, and I'm grateful to him for his support and indeed the support of the urging of the chair of the Select Committee. On contact tracing, we of course continue to work on the constant improvement needed on contact tracing, but as he said, the expansion of testing in a radical way because of the new technology that we've invested and spent months working on means that we will now be able to find more of the primary cases, more of the people who've got the disease, and then are able to get them and their contacts to isolate, because the single most important challenge is finding the people who have the vaccine, the virus in the first place. He mentioned children. This vaccine, on the vaccine, this vaccine will not be used for children. It hasn't been tested on children, and the reason is that the likelihood of children having significant detriment if they catch Covid-19 is very, very low. So this is an adult vaccine for the adult population. He asked about the JCVI prioritisation. It is really important that we prioritise according to clinical risk. And the JCVI have absolutely looked into all of the risk factors, including ethnicity as one of the risk factors. They have concluded that age and if you work in health and social care are the two prime risk factors that far outweigh any other. And so they are the primary risk factors that cascade into the draft interim prioritisation that they published on the 25th of September, which of course will be updated as they get the final data that comes through from the clinical trials. The opposition spokesman asked about the proportion of the population needing vaccinating. Now, the honest truth to that question is we don't know what proportion of the population vaccination needs to reach in order for this to stop the epidemic. And the reason we don't know that is that you can check in a clinical trial for the impact of the vaccine on protecting the individual. 43,000 individuals, half of whom have had the vaccine. What you cannot check is the impact on the transmission of the disease by those people, because you have to have enough of the population, a significant proportion of the population, to have had the vaccine to understand that. This is the difference between a so-called disease-modifying vaccine, which is testing how much it affects the disease an individual suffers if they get COVID-19, versus an epidemic-modifying vaccine, which is the impact on the spread and the transmission of the disease. And you can't know that until after it's been rolled out, and so we will monitor it very closely. Finally, he asked questions about the manufacture, which of course is important. On this vaccine, that is a matter for Pfizer. It is a difficult process. And also the distribution, which is a huge challenge, being led by the NHS, as I say. The cold chain requirements, because this vaccine has to be at -70 for until the final hours, the cold chain requirements are significant and do add to the logistical complications. But we have known about that cold chain requirement for many months now, so it's been part of our planning for some time. And so we have a good degree of confidence that that will be in place. And finally, he asked about international collaboration. I'm absolutely delighted that the UK has been a leader in the efforts for international collaboration to find a vaccine, putting more money in than any other nation. coordinating and bringing together scientists and vaccine specialists, and also using our aid budget to ensure that people around the world get the vaccine, in countries which wouldn't be able to afford to vaccinate their own population in some cases. So we are a big part of the international work here, and I very much look forward to working with colleagues in the United States and everywhere else around the world on making sure that we can have a global vaccination program as soon as a safe and effective set of vaccines can be made available.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. Can I congratulate warmly the Health Secretary on securing access to the new vaccine? Choosing which vaccine to back must be a bit like playing roulette, and to secure 40 million doses of the very first vaccine to prove efficacious is an enormous achievement for the country, and he deserves great credit for that. And I also want to thank him for bringing forward the introduction of weekly testing of NHS staff to the end of next week, which will reassure our very, very hard-working frontline staff that they are not infecting their own patients, which is, of course, one of their primary worries. The biggest issue we face now is the fact that only around a fifth of the people that we ask to isolate are actually complying. And of course, we don't even know all the people that we would like to ask to isolate in the first place. I just wonder what he thinks of Sir John Bell's suggestion to the Select Committee this morning that instead of asking people to isolate, we should give them 48-hour lateral flow tests and then only ask them to isolate if they're positive.
Thank you very much, Mr. Speaker. I'm grateful to my right honourable friend. He's very generous with his words. I'd also direct his warm words of gratitude to the Vaccines Task Force, who've done so much work on making sure that we can procure these and secure the supplies of these vaccines, should they prove safe as well as efficacious. On the question that he asked about Sir John Bell's comments, what I'd say is that option of testing people regularly, not if they're the primary case, not if they have the virus, but if they are contacts, that option wouldn't even be open to us had we not secured the huge capacity for lateral flow testing that we now have in this country. It's something on which I very much look to the clinicians for advice. Sir John Bell is a highly respected clinician and expert in this area, and it's something that I'm sure everybody will want to look at closely.
Let's head up to Scotland to the SNP spokesperson, Dr. Philippa Whitford. Dr. Whitford.
Thank you very much, Mr. Speaker. With 3.5 weeks left of the current lockdown in England, what does the Secretary of State plan to change so COVID-19 doesn't just get out of control again when restrictions are eased? He mentions the pilot project of population testing in Liverpool using newly developed lateral flow tests. But there isn't yet published sensitivity or specificity data for these tests. So what's the risk of false negative or false positive results? And has the UK National Screening Committee been involved to help assess the risks, benefits and costs of such mass population testing? I welcome the progress made on the Pfizer vaccine, but it will take time before it's widely available. And as he said earlier, we don't yet know if it will reduce transmission, so it doesn't remove the need to control viral spread using current measures. While I also welcome the expansion of PCR testing, I'm sure he recognises that it's not just the number of tests available that matters, but that testing is part of a test, trace, isolate and support system to be effective. 5 months on, Serco are still struggling to reach even 60% of contacts. So will he copy the more successful approach of the devolved nations and fund local public health teams so they can lead contact tracing in their area? An effective test and trace system can identify those carrying the virus rather than isolating everyone in a lockdown. But it's isolation which actually breaks the chains of infection. So is he concerned that so few people are isolating when they should? And how does he think that can be improved? People won't stay off work if it means they can't feed their family. So how will he make access to the government's isolation payment easier?
Thank you very much, Mr. Speaker. Well, of course, we're working to ensure that by all of us working together and making sacrifices, we can come out of this lockdown into the tiered approach that we had in place beforehand. That is the goal, and the more that people follow these rules during the lockdown, the more effective that will be. And we obviously monitor the data very closely on that. She asked about the lateral flow tests and their sensitivity and specificity. Of course, this is assessed. It's an incredibly important question. And the assessment of these tests that we're using in Liverpool and now rolling out elsewhere was made at Porton Down. And then in the field, we tested 5,000 of the lateral flow tests alongside 5,000 PCR tests of the same people and have a high degree of confidence that they can find people who are infectious. And in fact, they have a lower false positivity issue than the PCR tests. So they are very effective for the right use cases, including mass population testing. She asked about isolation. Of course, isolation is important. I would just mention to the honourable lady that right across the UK we have test and trace systems in place. There is a difference in how a successful contact is measured, it turns out. In England, we are much stricter on requiring a contact to be confirmed contact with somebody rather than just sending them a message. That doesn't count as contact in the English system. It does count as contact in some of the devolved and local systems. So it's just really important that we actually measure the same thing rather than trying to make divisions where divisions don't exist. And finally, on the point about isolation, of course, it's vital that people isolate when they test positive or when they're asked to by NHS Test and Trace. I would just gently, again, say that the 20% figure is not particularly robust, because it implies that 80% of people aren't doing anything to isolate. That isn't actually what that survey found. But nevertheless, we all should be urging people and requiring people to follow the rules. When they test positive, you must isolate. When you are in contact, you must isolate. That is part of your social duty.
Damien Green.
Thank you, Mr. Deputy Speaker. It is indeed a relief to have some hope introduced into our discussions about COVID. And I'm glad that the Secretary of State has announced that the use of the rapid result lateral flow tests will be expanded to new geographical areas. But will he consider, as this rollout continues, offering these tests to specific groups, perhaps particularly close relatives of care home residents who are desperate to be able to make regular visits?
Yes, of course. I've seen some of the heart-rending stories, and I've met people who are affected by their inability to see their relatives in care homes. The lateral flow tests that we're sending out to directors of public health, they can use for use cases they think are important locally. So they can use them for this purpose if they so choose. But we're also looking at a broader solution to this problem, which is a conundrum we've discussed many times in this House, that we need to keep people in care homes safe, but at the same time, of course, we want to allow as much visiting as can be safe, which itself directly impacts on the health of many residents.
Meg Hillier.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, it would be very helpful to know how long the rollout of the vaccinations will take once the Secretary of State gets the go-ahead. But what he's outlined, Mr. Deputy Speaker, is a major government project that doesn't stop with the first vaccination. And with the mutations rife in Denmark and elsewhere, it could affect children in future. So as part of his major project planning, how is he going to make sure that we can logistically get this out through the entire population if that does sadly become necessary?
Yes, it's a very, very good question from the chair of the Public Accounts Committee. I would expect nothing less. The critical question is, the critical answer to how long this takes is it depends on the speed of manufacture in the first instance. My goal, and the goal I've set the NHS, is to be able to roll this out as quickly as it can be manufactured. And that manufacturing schedule is itself uncertain because this is really hard stuff to make. We have got the major projects authority in the government involved in many of the projects that we've built up in the department over the past 9 months, because I respect their views and their ability to kick the tires. This is a huge endeavour, the rollout of the vaccine, but it builds on the annual rollout of the flu vaccine. It's just bigger and over a shorter period, and needs to be done faster.
Mark Posey.
Mr Deputy Speaker, the past few months have been a rollercoaster ride for families, businesses and public services as they've tried to make plans for the future. Now, the Secretary of State has rightly spoken of the need for caution about the rollout of a vaccine, but I think what my constituents would like to hear from him, if he's able to say, is when can they safely start to consider family events and holidays, and when will businesses be able to get back to something like business as usual?
I understand the yearning for this certainty. All I can say to my honourable friend in honesty is that I want us to get back to normal as quickly as possible, and yesterday's news is a big step forward, but it isn't the only step. There are more steps that are needed. The scientists are now offering views on that sort of timetable, but the government's view is that we must make this happen as quickly as possible and to be ready to roll out as fast as this any safe vaccine can be manufactured. But we will not put safety at risk. That is a lodestar of the programme, and therefore we've got to await the clinical safety sign-off before we can take this to the next stage.
Mary Kelly-Foy.
Thank you, Mr Deputy Speaker. We know that those in the most deprived areas are around twice as likely to die from Covid-19, and those in the least deprived areas. We also know that the most deprived people in society are less likely to take up a vaccine and health services. So can the Secretary of State tell me what plans he has made to ensure a high take-up of any Covid-19 vaccine amongst the most deprived, and if he will consider setting an inequalities target for this?
Well, we are, of course, concerned about this, and will put in enormous efforts to try to ensure that the take-up of the vaccine is as equal as possible. The first starting principle is that we will roll out the vaccine according to clinical need across the whole of the UK, across all 4 nations, working, of course, through the devolved NHSs, which are going to be critical to actually delivering the vaccine in the devolved nations. But this is a UK programme. The procurement of this vaccine, we've been working very closely together. And in terms of the rollout amongst deprived communities and amongst harder to reach communities, we have particular emphasis on trying to make sure that we get as equal a rollout as possible. The starting point must be clinical need.
Duncan Baker.
Thank you, Mr Speaker. Not a day goes by when I don't hear from or try and help a constituent to see a loved one in a care home. And in so many cases, we know that people haven't been able to see their loved ones for months and months. Given I'm the MP for one of the oldest constituents in the country, North Norfolk, can you give me my absolute reassurance that we will have enough vaccinations to support not only the vulnerable in my care homes, but also those amazing workers that have done so much over the pandemic?
Well, Mr. Speaker, precisely because of the reasons that my honourable friend sets out, the top priority, according to the clinical analysis for this vaccine, is the residents of care home and the staff who work to look after them so well. They are in the very first categorisation because they're the most vulnerable to this disease, and because living in a care home, because of its nature as a generally communal environment, means that they're particularly susceptible. And representing the oldest constituency, as I understand it, in the country, Mr. Speaker, that sort of prioritisation will mean, I'm sure, that should this come off, and if the other hurdles are passed, then there'll be a lot of vaccine heading to North Norfolk.
Mira Wilson.
Mr Deputy Speaker, of course the news about the Pfizer vaccine is extremely encouraging, and we're all hopeful that it's proved safe and effective and approved by regulators. If that is indeed the case, given that it's being manufactured in Belgium, and as he has noted, it has to be kept at minus 70 degrees at all times until shortly before administration, what arrangements is he putting in place to ensure that there is absolutely no delay of the supplies at the borders following the end of the Brexit transition period? Because any significant delay could, at worst, result in precious supplies being damaged and rendered useless, which could delay rollout.
Exactly.
We are, of course, we've looked at this risk, and I have confidence in our plans to be able to deliver the vaccine, whatever the outcomes of the negotiations over our future relationship with Europe.
Jenkin.
Thank you, Mr Deputy Speaker. My right honourable friend's plan, he keeps reporting to the House, our strategy is to suppress the virus until a vaccine can be deployed. But this is still beset by so many uncertainties. Who would have thought that mink in Denmark could throw a spanner into this situation? And isn't the tracing capability and the ability to get people to isolate absolutely crucial? And who should be held accountable for whether that is operationally effective as we come out of lockdown? Because that's the only time we've got to make this work. Otherwise, we'll be in another lockdown.
Well, of course, Mr. Deputy Speaker, it is very important that we continue to build and strengthen the contact tracing system as we are doing. And my right honourable friend mentions the uncertainties and the issue around the virus that has spread back from mink to humans is one example of that. Of course, managing a pandemic is beset by uncertainty. We still have uncertainty, for instance, over whether even the Pfizer vaccine will pass the safety hurdles that we very much hope that it will in the coming weeks. But managing through that uncertainty is an absolutely critical part of getting this right.
Jim Shannon.
Mr Deputy Speaker, and I can thank the Secretary of State for his statement today in the House. And isn't it good, Mr Deputy Speaker, to see the nation regain at least a smile in relation to the potential of a vaccine, and that's got to be good news for us all. Will the Secretary of State outline how he intends to ensure that, unlike the flu vaccine shortage that the nation is at presently operating, and my own constituency for one, that each region will receive the necessary amount, and that rather than estimations that the health service will allocate on priority need and not on postcode?
Yes, absolutely. This is a UK programme. I've been working closely with my Northern Ireland counterpart, Robin Swan, who's doing a brilliant job in Northern Ireland to make sure that we get this rollout as effective as possible right across the whole United Kingdom.
Andrew Ledson.
Mr Deputy Speaker, happy birthday today. I know my right honourable friend is as concerned as I am about the impact of lockdown, particularly the first lockdown, on those new families with new babies, and in particular as seen from the excellent Parent Infant Foundation report on babies in lockdown and the awful news from Ofsted that some babies have been harmed more than you would expect during that period of time, potentially as a result of poor mental health and so on. So can my right honourable friend tell us what exactly he is doing to make sure that during this current lockdown, new families are being provided with the right level of support from partners and from statutory services that they need to help them through?
My right honourable friend is right to raise this issue, and we all know how close it is to her heart. In the first lockdown, many NHS services were suspended, partly because of the uncertainty that we've just been talking about. We know far more both about the virus and about how to manage it second time round, and our goal is that all NHS services stay open. Now, that is not that hasn't proved possible in the areas of the country where there is the highest prevalence, but all maternity services and services around perinatal health ought to stay open everywhere. We have had to delay some non-cancer, non-urgent treatment, But crucially, the best thing to do for this agenda that she champions is to try to keep the virus under control and try to suppress the virus as much as possible.
Sana Begum.
Thank you, Mr. Deputy Speaker, and happy birthday from me too. As well as age and underlying COVID conditions, the JCVI notes that early signals have been identified of other potential risk factors, including deprivation and ethnicity. But there has been numerous amounts of research and evidence showing that Black, Asian and minority groups are at risk of this virus. Given the occupations, given the overcrowded households that they disproportionately represent, why have they not been included in the composition and order of priority of groups for vaccination?